Hello, everybody. Hi, it's Yvette McQueen, MD, emergency physician, travel doctor, and wellness lifestyle coach, a global physician on a mission to educate about health, travel wellness, and disease prevention. So, yes, I'm at work, night shift, in an emergency room. I just wanted to come and talk about travel a little bit. I haven't talked about travel in a while. Now, everyone's saying, oh, well, you've been traveling. Yes, I have. I've been traveling because that's what I do. It's called travel doctor. I don't drive to work. It's not around the corner. It's not across the street. It's not across town. I actually have to get on a plane to come to work. That's what I've been doing. Have I been taking vacations this summer? I did take a little brief vacation in which I drove. My nephew and I went to the beach. We drove. We were with people we know. We were still isolated, and that was my vacation and being with family. So I know a lot of people are traveling. They traveled a lot this summer. Wow. Airports and airlines were packed. And now they're going back to school. People are still talking about traveling. You know, I listen to the different travel groups, different travel people, and they're like, you know, last year we couldn't travel, we couldn't do our norm, we felt like we needed to get out. I don't make judgment about people, what they need to do, because some people need to do it for work, some people need to do it for sanity, some people need to do it because they want to do it. All I say is please be cautious, very, very cautious, particularly with the new Delta variant. It is very highly contagious. It is transmittable. You can, even if you're vaccinated, can carry it. You can be a carrier. You can carry it to someone who is not vaccinated. So our healthcare system right now is overcapacitated. I had to call 13 hospitals the other day to transfer a patient that needed an ICU bed. Yesterday, I'm sitting here watching the news and I get all these reports from different people saying that Grady. So some people may not be familiar with different healthcare systems. Grady Hospital is the big trauma center in the Atlanta area. But even if you don't know the Grady system, think about their biggest hospital in your big city, your university big trauma center hospital that's known in your city. I mean, I can count a lot of them. You know, there's Cook County, and there's, what's the one in Dallas? Parkland, and of course MLK, UCLA. Any of those. Think about that. If they told you all those big hospitals was on divert, that means that they're telling ambulances not to come, even though ambulances still come. They can't accept any transfers. That they're on divert. They're overcapacitated. That they are almost full. Because they're almost full of, particularly of patients that are COVID positive and they're taken care of, that if someone should have an MI, a heart attack, if someone should have a stroke, if someone should have a serious car accident, they may not be able to have the room to take care of them. If you're in a small hospital off somewhere and I get somebody that has a rollover car accident and I need to send them to a trauma center because that small hospital cannot take care of that patient, I have nowhere to send them if that big system is on divert. Grady. I was like, Grady's not on divert. I was like, what? So our hospitals are overcapacitated. So I'm just saying, please be cognizant of what you do, as because your actions are affecting actions of your community and the public during this pandemic. If you want to travel, please check your destination. What is their positivity level? What is their COVID positivity? They say that if it's over 10%, there should not be any gatherings or meetings. Are you going to an international destination that their healthcare system cannot take it if you're transmitting the disease? So you're like, okay, I want to go to the small island, I'm just calling it whatever, and their healthcare system, if you unknowingly transmit the disease, I mean, you may have not any symptoms, but you take the virus to them, and then, you know, the hotel worker gets it, the cab driver gets it, the restaurant person gets it, and their small hospital gets overrun. They don't have resources to say, hey, I can send this 3 states over. They can't. And I've worked on different islands, and trying to ship a patient off an island is even more tasking than it is from shipping it from city to city or state to state here on the continent. So be cognizant and look to see what the positivity rate of the destination you go into. Look to see what their healthcare system and what they can take. I mean, if you get there and you get sick, would they be able to take care of you? Or are you going to be the one that needs to be flown off? I mean, I get it. I'm a traveler. I love to travel. I have not traveled. I can say, you know, I have not been to Europe since 2019. No, everyone that's close to me knows I like to go to France. I like France. Ah, je m'appelle Yvette. Et je mange français food. I love français food. But I haven't gone. You know, I went to Africa to teach in February 2020, right before everything shut down. The last time I went to Africa. Haven't been to Malawi since 2018. So I'm curtailing it, and I'm staying right here in the United States as I go from state to state because I'm working mostly. But just be cognizant of what you're doing. I mean, people, let's not be selfish. Ooh, did I say that out loud? I said what I said. Think about not only yourself, think about your family, your community, and the world that you're living in, because this is a pandemic. It means it's across the world. It's not just here in the United States, it's other places, and other places cannot compensate sometimes. You know, we don't want to be, you saw the stories about how other countries, I'm not calling out any names, but they're saying people were dying outside the hospital on the sidewalks in the grass. We don't want to end up being that in the United States, and we're coming close to that. It is coming close to that, and a lot of my healthcare colleagues is having post-traumatic stress syndrome from having to deal with it for the last 18 months. Yes, if people feel they've been locked up, they can't travel, they can't do that, and guess what we've been doing for the last 18 months? Okay, that's what I came to say about travel. I don't say much. I don't give much judgment most of the time, but I just give the facts and information. And this time I actually gave some opinion. And it is what it is. So I am Yvette McQueen, MD. You are on one of my sites if you're seeing this. And that's Yvette McQueen, MD, across the board, Instagram, Dr. Travel 911. So follow me. Get my book, Travel 911. Keep you healthy while you are traveling, wherever you travel. Stay safe, stay well. Peace and love.